What's the difference between pregnancy and thyroid symptoms in mothers? Imagine feeling exhausted all the time, gaining weight, and feeling unusually cold during pregnancy. It can be confusing to tell if these are normal pregnancy symptoms or signs of a thyroid problem. Understanding the differences is essential because untreated thyroid issues can impact both the mother and the developing baby. Pregnancy naturally brings about many changes. Fatigue, weight gain, feeling warm, mood swings, constipation, and irregular periods are common. These symptoms often overlap with thyroid disorders, making it tricky to tell them apart. But some signs are more specific to thyroid problems. Hypothyroidism, or an underactive thyroid, symptoms tend to be more persistent and severe. Expect to see ongoing fatigue that doesn't improve with rest, significant weight gain beyond what pregnancy alone would cause, and cold intolerance. Dry skin, brittle nails, hair thinning, and hair loss are also common. You might notice swelling in the neck, known as a goiter, or puffiness around the eyes. Muscle cramps, joint pain, and difficulty concentrating or memory issues can also occur. Women with hypothyroidism may have irregular or heavy periods even before pregnancy. On the other hand, hyperthyroidism, or an overactive thyroid, often causes symptoms like rapid or irregular heartbeat that go beyond the normal pregnancy increase. Unexpected weight loss or failure to gain enough weight during pregnancy can be a sign. Shaky hands, excessive sweating, and feeling uncomfortably hot are typical. Anxiety, nervousness, and trouble sleeping are common. Some women with hyperthyroidism develop eye changes like staring or bulging eyes, especially if they have Graves' disease. You might also see a visible enlargement of the thyroid gland or skin changes such as pretibial myxedema. The key difference is that thyroid symptoms tend to be more intense and persistent than normal pregnancy changes. For example, pregnancy usually causes a slight increase in heart rate, but if you experience severe palpitations or a very fast heartbeat, it could be a sign of hyperthyroidism. Similarly, pregnancy often leads to weight gain, but if you notice unexplained weight loss, it might indicate an overactive thyroid. Cold intolerance and dry skin are not typical pregnancy symptoms and could suggest hypothyroidism. Because symptoms can overlap, healthcare providers recommend thyroid function tests during pregnancy if thyroid disease is suspected. These tests measure thyroid-stimulating hormone and free thyroxine levels to give a clear picture of thyroid health. Women with known thyroid conditions should have regular monitoring throughout pregnancy to keep hormone levels balanced, which helps prevent complications like miscarriage, preterm birth, or low birth weight. If you have thyroid issues, early diagnosis and proper management are vital. Treatment may involve thyroid hormone replacement for hypothyroidism or medications to control hyperthyroidism. Regular checkups with healthcare professionals who specialize in thyroid and pregnancy care can help ensure both your health and your baby's development are protected. In summary, while pregnancy and thyroid disorders share symptoms like fatigue and heart rate changes, thyroid symptoms tend to be more intense and come with specific signs such as goiter, tremors, or cold intolerance. Recognizing these differences and seeking medical advice can make a big difference in ensuring a healthy pregnancy. Always consult your healthcare provider for personalized care and testing if you notice symptoms that seem unusual or more severe than typical pregnancy changes.